This video is on acquired disorders of the nervous system and is brought to you by Brent, Jesse, Ethan, Kylie, and Will. As a brief outline, Brent will start off with polio. Next, Jesse will discuss tetanus, followed by Ethan, who will talk about Bell's palsy. Lastly, Kylie will discuss the science behind Parkinson's, and I am going to follow it up with a short talk on Muhammad Ali and his Parkinson's diagnosis. Without further ado, I'll let Brent take it away with his talk on polio.
Polio, short for poliomyelitis, is an infectious disease that is caused and transmitted by a virus called the poliovirus. One of the severe symptoms of polio is paralysis, which happens among a tiny percentage of children who are infected, and the disease is therefore also known as infantile paralysis. The name poliomyelitis is derived from Greek and translates to gray marrow or matter, which refers to the tissue in the center of the spinal cord, which when affected by the poliovirus infection causes paralysis. Paralyzed limbs such as arms or legs waste away over time, which is the cause of deformed child legs most commonly being associated with the disease polio. Polio would often be transmitted through water contamination of stool, hygiene, and flies, less often through droplet or saliva. When a child is infected with polio, the virus it attaches in the throat and intestinal tract. It can then multiply there and spread. When the virus spreads to the central nervous system, it attacks the gray matter in the spinal cord, which can lead to inhibition of afferent pathways from the brain to the extremity. This is what causes the paralysis of the leg or arm infected. Unfortunately, the majority of infections do not lead to any symptoms, which makes it easy for the virus to spread through a population. About a quarter of cases, 24%, result in abortive poliomyelitis, which leads to nonspecific symptoms for a few days, such as a fever or cold, and 1 to 5% of cases lead to non-paralytic aseptic meningitis, in which the patient suffers from stiff limbs for up to 10 days. Permanent paralysis, which was seen in children, occurs only in 1 of every 200 infections. Even children who seem to fully recover can develop new muscle pain, weakness, or paralysis as adults. 15 to 40 years later, this is called post-polio syndrome. In 1947, the polio vaccine was invented, and there is now 2 forms, the OPV and the IPV. America has used the IPV since the year 2000 and will likely continue to do so since the disease is nearly eradicated here. However, many other parts of the world still use OPV, and the disease is still found in third world countries today.
Tetanus is a bacterial disease marked by rigidity and spasms of voluntary muscles, leading to painful muscle contractions, particularly of the neck and jaw. It is often referred to as lockjaw. Tetanus itself comes from the bacteria Clostridium tetani, which is a gram-positive, anaerobic, rod-shaped bacteria that produces terminal endospores. Tetanus is not transmitted from person to person. Instead, one might become infected with tetanus when dirt enters a wound or cut. Tetanus bacteria is most likely to grow in deep puncture wounds caused by dirty nails, knives, tools, wood splinters, and animal bites. When tetanus spores are introduced into a wound, the low oxygen environment allows the tetanus spores to germinate. The spores also release a toxin called tetanospasmin, which enters the bloodstream. Bacterial numbers grow exponentially as they divide. We all know that skeletal muscles control our body's movement. An electrical message is sent down the axon of a motor neuron. Neurotransmitters are released and bind to muscle fibers, causing them to contract. The neurotransmitters are then released from the muscle fibers, allowing them to relax. When someone is infected with tetanus, the tetanospasmin toxin can reach motor neurons through the bloodstream. The toxin travels toward the neuron cell body and the spinal cord. The toxin reaches its destination in 2 to 14 days. The toxin interferes with inhibitory interneurons. Inhibitory interneurons keep motor neurons from constantly firing. When the toxin reaches the interneuron, it prevents the release of inhibitory neurotransmitters. The interneuron now has no control over the motor neuron, causing it to fire constantly. This means there is a constant release of neurotransmitters to skeletal muscles, making the muscle contract repeatedly until a spasm occurs. The symptoms associated with tetanus include stiffness of the neck and jaw muscles, often accompanied by a sneering or grinning expression, difficulty swallowing, fever, sweating, uncontrollable spasms of the jaw and neck muscles, and painful involuntary contraction of other muscles. There is no cure for tetanus once it is contracted. However, tetanus vaccinations can prevent you from getting the disease in the first place. There are 4 types of tetanus vaccinations: DT, DTA2, TD, and TDAP. Children receive DTAP at 2, 4, and 6 months, again at 16 months, and again at around 5 years of age. A shot of TDAP will be administered around 11 years of age, and a shot of either TD or TDAP will be given every 10 years after that into and throughout adulthood.
Bell's palsy is a condition that causes temporary weakness or paralysis in the muscles of the face. It results from the swelling and inflammation of the 7th cranial nerve, also known as the facial nerve. The facial nerve innervates the muscles of the face, including the ones used in blinking and facial expressions. It also directs nerve impulses to tear glands, saliva glands, and the muscles of the stapes found in the middle ear. The majority of the facial nerve is encased in a bony passageway called the fallopian canal. How the inflammation and compression of the facial nerve comes about is not fully understood. Many scientists believe it is due to a viral infection like meningitis or the common cold sore virus, herpes simplex. The nerve swells and becomes inflamed as a response to the infection, causing pressure within the fallopian canal. This buildup of pressure leads to ischemia of the facial nerve. As a result, the messages sent from the brain are unable to travel the full length of the facial nerve, which leads to the symptoms of Bell's palsy. The symptoms of Bell's palsy vary from person to person. The most obvious symptoms include paralysis on one side of the face, twitching, and weakness of the facial muscles. Other symptoms include drooping of the eyelid in the corner of the mouth, drooling, excessive tearing in one eye, and loss of taste. Bell's palsy affects men and women equally and can occur at any age. It is, however, less common below the age of 15 and above the age of 60. Bell's palsy is often associated with diabetes and high blood pressure. Because the effects of Bell's palsy vary from person to person, so does the treatment. Some cases are relatively mild and can disappear on their own within 2 weeks. Treatments that have been found successful are the use of steroids to reduce inflammation and swelling, and antibiotics used to fight viral herpes infections. Eye protection is important when treating Bell's palsy because of the inability of the eyelid to function properly. This exposes the eye to irritation and chances of drying out. It is important to keep the eye moist and protected. Most people see recovery from Bell's palsy within 2 weeks and return to normal function within 3 to 6 months.
Parkinson's is a nerve degenerative disorder in the brain. It is the second most common degenerative neurological disorder, Alzheimer's being the first. 1% of the population over 60 years old has Parkinson's, and right now about 1 million people in the United States have it as well. The cause of Parkinson's is not known for sure. 10% of people who have Parkinson's have family members that have it as well. Genetics play a huge role in the development of Parkinson's. Exposure to hazardous toxins can also increase your risk for Parkinson's in the future. Lewy bodies in the brain may also show the cause of Parkinson's, along with Alzheimer's as well. Lewy bodies are clumps of misfolded proteins in the brain. If these are detected in an individual, they could be the cause of the Parkinson's. Parkinson's occurs when neurons that produce the neurotransmitter dopamine start to die off. This results in a low amount of dopamine produced in the brain. When 80% of dopamine in the brain diminishes, the brain starts to act unusual. Dopamine is a neurotransmitter responsible for helping transmit signals in the brain. With the loss of dopamine, the brain has a hard time relaying messages to the receptor cell. In this picture, there is a significant amount of dopamine lost in the Parkinson's patient. With this little amount of dopamine that they have, it can become very challenging for the brain to communicate with the receptor cells. Basal ganglia nerves deep in the brain also start to die off in a Parkinson's patient. This picture shows the structures of the basal ganglia. Basal ganglia are responsible for initiating and smoothing out voluntary muscle movements, suppressing involuntary movements, and coordinating changes in posture. Neurons in the substantia nigra of the basal ganglia produce dopamine. These are the ones that die off during Parkinson's, which results in the lost amount of dopamine. Many of the symptoms of Parkinson's are due to the impact it has on the autonomic nervous system. The autonomic nervous system controls all of the involuntary movements in our body, the things we can't control. Parkinson's slows the firing of neurons in the brain and does not allow these muscles to contract smoothly. Difficulty swallowing. Parkinson's can cause problems in swallowing because swallowing is partially voluntary, so the muscles do not contract at the right times. Drooling can also happen with Parkinson's because when swallowing is slowed down, more saliva builds up in the mouth and falls out. Chewing and eating problems can also occur because the muscles of mastication do not contract as smoothly. Many individuals with Parkinson's experience feelings of depression due to the decrease in dopamine levels in the brain. Low levels of dopamine can cause lack of motivation. The medicines for Parkinson's can also make people feel depressed. The majority of people experience depression with Parkinson's. Difficulty sleeping. Many Parkinson's medications wear off at night, so people experience tremors and pain during the night that disrupt their sleep. Antidepressants and dopamine medicines can cause vivid dreams or nightmares. Sleep apnea can also occur because of the inability to control voluntary and involuntary muscles. People can also feel sleepy during the day since they do not get quality sleep during the night. Constipation. The gastrointestinal tract is impacted by Parkinson's because it is part of the ANS. Food moves slower through the tract because the muscles are not contracting when they are supposed to, so constipation will often occur. Incontinence. Parkinson's affects involuntary movement, which includes the bladder, so it can cause issues with urination. Who is most at risk? The risk for Parkinson's increases with age. It is most commonly developed around age 60. And men are more likely to develop Parkinson's than women. There are not very many ways to effectively treat Parkinson's yet. However, giving patients a drug called L-DOPA is the most effective way to treat Parkinson's. L-DOPA can enter into the blood-brain barrier and be converted into dopamine. However, there are many drugs that patients with Parkinson's take to inhibit the breakdown of dopamine, and they react with L-DOPA to decrease its effectiveness. In extreme cases, when drugs are not working, patients can receive deep brain stimulation with electrodes that shut down brain activity to help with tremors. Although Parkinson's is not curable, people can still live a happy life with PD.
It has been widely argued that the multiple head injuries Muhammad Ali sustained during his boxing career could have caused his Parkinson's disease. In reality, the science behind it is much more nuanced. Expert theories vary on whether head trauma is linked to the disease. In short, Parkinson's kills off the neurons in the brain that produces dopamine, which leads to issues with movement. Ali was diagnosed with Parkinson's in 1984, 3 years after he retired. His doctors did not connect the disease to injuries he received from boxing. Marie-Françoise Chesselet, professor of neurology at UCLA with several publications on Parkinson's, said there are studies that show that a severe traumatic brain injury can increase the risk of developing Parkinson's disease later in life. However, the studies are not conclusive since other factors, such as environment or genetics, can also factor in as causes, she said. Cheslett used the example of the pesticide paraquat to further elaborate. Sometimes exposure to paraquat shortly after traumatic brain injuries can increase the chances of developing Parkinson's disease later on in life. In the case of Ali, people have suspected for a long time that his symptoms may be related to his repeated head injuries he has sustained in his life, but argue whether it is related to Parkinson's disease or not. This will be settled if an autopsy is conducted, Cheslett said. On the other hand, Dr. Becky Port, Senior Research Communications Officer at Parkinson's UK, said currently there is no evidence that single mild or moderate injury to the head levels to the head leads to Parkinson's. Even though there is a recent study linking severe and repeated head injuries to a higher risk of developing Parkinson's, Port maintains the risk, although higher, would still be very low. Dr. Omar Alagnaf, director of the neurological disorders at the Qatar Biomedical Research Institute, said there are enough studies to support the hypothesis that brain trauma increases the risk for Parkinson's. We believe that boxing could lead to Parkinson's disease, he said. Acquired disorders of the nervous system are complex. However, with the help of modern medicine, we have been able to treat these disorders by curing whole populations with something like a vaccine. In the event that there isn't a vaccine, we have been able to use countless therapies and treatments to mitigate the effects of diseases like Parkinson's or Bell's palsy. One day, as future healthcare providers, it will likely be our job to treat people with acquired disorders of the nervous system.